of the Cayman Islands.
This is For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadena Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
Running on empty? Feeling depleted? Health and wellness comes down to one essential factor: energy at the cellular level. Our body is designed to support, repair, recover, and heal, but it needs the right environment. At the Lightroom, our energy enhancement system is that right environment, a balanced bioenergetic support for your body's natural processes. Don't wait until your energy is depleted. Recharge and keep optimized. Start today. The Lightroom, advanced energy therapies that work. We're in Pasadena Place.
Your health is everything, and it's important to have a doctor who cares. Dr. Sidney Ebanks, proud Caymanian, has a big heart for his community, specializing in complex cases, urgent care, and preventative medicine. Dr. Ebanks offers over 20 years of experience. He listens to your needs, your frustrations, and what you're experiencing. He treats more than just the illness. He treats you. Dr. Sidney Ebanks, where care meets compassion, because every patient deserves a dedicated doctor who cares. Call Dr. Ebanks at Grand Harbor Medical today at 949-4309.
There's nothing more important than your health, and seeking expert healthcare with physicians you can trust is what you deserve. UHealth, the University of Miami health system, offers peace of mind to you and your family with a first-class experience. Our patient coordinators assist with everything you need before, during, and after your stay with us. As South Florida's only academic-based health system, UHealth offers cutting-edge treatment, compassionate care, and life-changing results just a flight away. Learn more at umiamihealth.org/international.
Hello and welcome to For the Health of It. Back in the studio with me today is Christine Connor from Anytime Fitness. She's the owner, and Dr. MUBEEM. He is from Grand Harbor Medical Center. And we're going to do part 2 of menopause. And Christine is on a mission for women to be thriving through this stage. And if you've reached this stage, whether you're in your early 30s, you might be not feeling like yourself. So we're going to go right into the questions. And this segment is more going to be focused on Christine, really, and what led you here and what you're doing with your bad self.
I'm not sure every day I ask myself that same question.
So has your perspective on aging changed?
Oh, absolutely. We laugh about this because I said, I think, again, talking about stigmas, there's always this stigma on women as we age.
Mm-hmm.
And, I got to 40 and everyone's like, oh, 40, and I actually was like, I'm okay with it. I'm happy with where I'm at. And now we have so much education out there and so many resources that I do genuinely think age is just a number, because I talk about this all the time. My father's 70 and he is the guy that's in the gym every day. He's always taking care of himself. He not only looks at least 10 years younger, but the way he is with my son and my nephew, like he's like a 40-year-old man, the way he can move. So I've had really great inspiration with my father, because like I see him and I'm like, age really is just a number. My mum, on the other hand, she knows how I've dragged her to Dr. MUBEEM already. I'm like, sort this woman out. She's the opposite, right? She's never really taken care of herself. She's never stepped foot in a gym. And she's feeling all the aches and pains. She looks older. So that's what's really been the example to me of actually, we are in control of how we feel and essentially how we look on the outside too, because of how we take care of our body and how we take care of our mind. So as far as aging, I am trying to age backwards or maybe just stop. Maybe just like stop at where I'm at. I'm good. But yes, I genuinely believe age is just a number.
Cool. And Dr. MUBEEM, what lifestyle changes do you think can women do to make a significant difference during this stage?
Whatever it is that you're going to do, start early. Right? So the earlier you start, we know from research that women who eat less ultra-processed foods, don't smoke, control alcohol levels, do weight-bearing exercise, and all of this from younger ages tend to suffer less or even postpone or keep at bay some of the more serious perimenopausal symptoms. And I suspect that's what's happened with Christine as well. So, because she's been working out her whole adult life, she's been able to manage to keep all of that at bay until, there's going to come a point where you can't fight nature and it's going to catch up. Right?
Never, Dr. MUBEEM.
Internally, perhaps, no, not necessarily externally. And so that was the point where it's actually starting to affect her. She's in peak shape, so she recognised when things just didn't feel right for her anymore. Right?
Okay.
And so she came in. But I can only imagine if it was somebody who hadn't really had all those years of exercising, eating well and looking after themselves. I actually know, because I meet people like this every day, always have the worst symptoms. And then it's a whole new habit that they have to form. And I suppose going back to what we were talking about in the last segment was about when you started the testosterone treatment, you started seeing the changes, and the changes themselves motivate you to continue. Right, so it's always about trying to get you to do something that will. For me, I'm always about pep talks. I'm always giving my patients pep talks, but trying to keep it really simple at the same time. There's somewhere out there's lots of literature that says you should have 150 minutes of weight-bearing exercise or cardio exercise and 120 minutes of weight-bearing exercise per week. That's a lot. I exercise a lot. You exercise a lot. I don't think either of us combined.
I actually exercise less now.
Right.
That's another thing. But we spoke about that.
Intensity rather than duration.
Absolutely. And the statistics out there, if you're somebody that has never had that routine, to all of a sudden tell somebody you have to do 150 minutes of cardio and 120 or 130 minutes of strength training a week. So I said to Dr. MUBEEM, I don't even do it. It's my job. So I think, again, we're really trying to encourage people that it's not about doing more. And in fact, that's why I try to use my experience is I do a lot less because doing more just actually adds more stress on the body. Right. Mentally, we're already, our brain capacity is already up there, and then we're going to put more stress on ourselves to have to hit these targets.
Exactly. It has to be manageable. It has to be
so we just want people to start with something.
I tell people, depending on who I'm talking to, I will say, look, let's start with a fast 5-minute walk per day. I'll make it even easier for you. Walk out of your front door and turn right. Now, I've given you a direction. You don't even have to think about that bit. Yeah. Just walk as fast as you can. Get your heart rate up. Get your breathing up. Sweat. Turn around and walk back again. We'll do that for a couple of weeks. Let's see how you start for you. And or you can start with a 5 minutes, 10-minute routine twice, maybe 3 times a week. That's it. Something really simple. And what always inevitably happens, you become fitter because you're doing something extra. And you notice the changes in yourself. And when you start noticing the changes, you create motivation. And next time it's going to be oh, I can do 10 minutes easily. Let's do 15. Or I can lift 10 kilos easily. Let's go to 15 kilos. So you progress slowly. But to come down on somebody and say, yeah, I think you need 2 hours of weight training per week plus 150 minutes of cardio, yeah, you're not seeing them again.
No. And Christine, when you said you do less, is that less intensity or more intense?
More intense, but not as far as like you're not going to see me sprinting on a treadmill. I am more intense as far as just when I'm actually there working out, I'm there to work out.
Yeah.
So strength training is what I'm really pushing with a lot of my female clients right now. There's just so much research, especially in this phase of our life. You know, again, we could go into this all day long about how our bone density decreases. So we have to do that weight bearing training. So when I say less, I basically have said to myself 3 times a week, 30 to 45 minutes, and I just really focus on a structured program doing the same things, progressive overload and strength training, not weight training, strength training, because that's what I'm trying to do, is keep my body strong for longer.
Yeah. I have to say that I was preparing for bilateral knee surgery, and one of the things I did was I lost weight, and I went back to the gym. And the weight was not coming off until I went back to weight-bearing exercise. It was not. No matter how much cardio I did.
That's right. And that's a big myth that a lot of people still follow.
I was just stressing out my body.
That's it.
Absolutely.
Yeah. And there's actually something I was reading yesterday about how training for women is not the same as training for men.
Yes.
Right? So
say that again, doctor, because I'm constantly saying this.
Yeah, people at the back. Yeah, training for women is not the same as training for men.
We're not small men.
You're not small men. Exactly.
Definitely not.
Right. So the research basically shows that you either do one end where you're nice and gentle, etc., or you do quite hardcore on the other end, right? In intensity, have high intensity. But the bit in the middle is where you end up causing more stress and not actually getting anything from it. And that's sort of where the cardio, I'm making air quote marks here, the cardio stuff falls into in the middle. Running is great. I'm not saying it's not. Swimming is great. It's all brilliant. But they're not weight bearing. They're not going to help you build muscle. And if you're not building muscle, you're not going to be losing fat, right? Muscle is hungry and it needs to be fed. And so it feeds off whatever you eat. It will burn up the fat, even at rest. You become more insulin sensitive. So your glucose intake gets used up by the muscles and the brain. And so there's more to it than just looking hench.
And Christine, can you tell our audience, what have you learned about self-care during this part of your life?
Well, self-care is not going to the spa. That's what I'll say. It's not just about going to the spa. I think self-care is, I could go into this all day long. So many things. I think advocating for yourself is really important. I actually did a post about this the other day and said how I don't get mum guilt anymore. And it took me a long, long time not to get mum guilt, because I've realized that we said about this when we talk about the analogy of putting your oxygen mask on first. There's a reason for that. If we don't take care of ourselves, how can we possibly take care of anyone else? And the reality is, as women, typically, more of the responsibilities fall on us, whether it's taking care of the children, taking care of parents. I'm kind of in that stage of life, taking care of household, wherever it may be. So again, using that analogy of putting on your mask first, I take such priority now in taking care of myself, having the boundaries, making sure, that I exercise 3 times a week. So that's a non-negotiable for me now. I do school drop-off, and then Monday, Wednesday, Friday, I have that hour to myself where I do my strength training. What else is self-care? Feeding myself and, making sure I have the right foods. And I mean, that's all stuff that we should know, but actually taking the time to make sure I eat.
Yeah.
because there's many a times I'm so busy, and again, going back to, feeding our muscles, but also our brain. We forget our brain needs fuel too. So I really take the time now to make sure I sit down and eat my meals and I'm not grabbing things on the go. Sleep is a big one for me. Anybody that knows me, I am the boring person that's in bed by like 9:30 because that's recovery is huge at this time in our lives too. So yeah, I guess the basic stuff for me, it's just putting myself first so I can also be in the best position for anyone else. But non-negotiables: sleep, recovery, my 3 workouts a week, and just making sure I'm fueled. And I guess that for me now, hormone, I'm doing regular hormone. I feel like I'm constantly asking you, when do I need to get my hormones checked again? I've made that a priority.
Okay.
Because that is the foundation of everything.
So this leads me to my hormone question. Woman comes to you and said, you do her panel,
right,
whatever. What is available for her to take?
Okay.
And is it good stuff or is it from the horse? Nah.
No, it is good stuff these days. Yeah, there was the whole issue back in the day, what was we talking about? The Women's Health Initiative in 2002, whatever it was, that triggered the whole HRT will give you cancer scare. And that was bad research with, unfair to say bad medicine, but it was new, so poorly understood medicine. Definitely come a long way since then. We have HRT now. I mean, I wouldn't talk about HRT without talking about testosterone, but we're just going to park that, and because I think we've talked about that quite a lot. But then you've got the patches, for instance. I'm a big advocate of the patches. So I have been certified by the British Menopause Society, the International Menopause Society, and the American Menopause Society. Is an exam I'm also going to sit, and I've been reading their material. So they all agree that micronized estrogen and progesterone, which is the newer version, the patches, is the top of the list because you don't have to take it orally. You're not taking huge doses.
Right.
Huge doses of estrogen taken orally, that increases risks of things like clots because it goes through the liver a couple of times, and the liver affects clotting, and therefore affects can trigger things like heart attacks, strokes, PEs. So the technology, if you like, the medicine exists, and it's very, very simple. Patches at the top, and then at the bottom tablets, and somewhere in between you've got compounded things, and then above that gels and sprays. But you want to make sure that what you're using is body identical, right? And the hormones that we're getting from the patches are exactly that. So they used to come from horse urine, right? And some of them even come from yams, the compounded things. But at the end of the day, it's still the same molecule. You're still getting estrogen. Under an electron microscope, you wouldn't be able to tell the difference, which animal or which vegetable it came from.
What are some non-hormonal treatments available?
Right. So it depends. The beauty of HRT with the estrogen and the progesterone and the testosterone is that a lot of symptoms can be treated with one thing. You replace a woman's estrogen, and suddenly hot flushes, brain fog, anxiety, palpitations, urinary problems, all settle. The non-hormonal things would have to be you're treating each symptom specifically, right? So you can have antidepressants, for example, can help with hot flushes. Not so much with the anxiety and the depression, oddly enough, right? Because the problem isn't in the brain as such. The problem is the lack of estrogen. But we know that SSRIs and other types of antidepressants can help with hot flushes. There are things like gabapentins. These are the medications for nerves that can also help with maybe anxiety, maybe with sleep, We've got medication that can help with bladder control as well. But again, what you're doing is, and then there's the natural stuff, that you can buy over the counter in the pharmacies, like black cohosh, for instance, which helps with hot flushes. It helps some women for a certain amount of time. There's always a disclaimer with the natural stuff, air quotations again, is that just because something is natural doesn't make it safe. Quite the opposite. Because it's natural, it can make it more unsafe. A lot of these things you could buy black cohosh from 3 different pharmacies or vitamin stores on island and anywhere in the world for that matter, and you would get 3, 4, 5 different versions of black cohosh. Because there's no regulation or standardization of these things, you or I could open our own company and start selling black cohosh within months.
Yeah.
Nobody's going to check what quality we put in, what other ingredients go in, if it works, if there's any research behind it. Nothing. So you have to be careful with the natural stuff. I give my ladies, them what are called patient information leaflets. So when they'll come in, I often give them something about what menopause is. So they understand it, so you don't have to go down some rabbit hole on social media, except my social media, of course. And then some information about what HRT is, but then also something about alternatives to HRT. So your knowledge base has increased, you understand. But again, the safety disclaimer always follows.
Okay. Which is
that natural does not necessarily mean it's safe.
Right. Christine, what conversations have you had with your family and partner about what you're going through?
It's funny, as I mentioned earlier with my mum, I remember just asking her the simple question of, how old were you when you went through menopause? And she was like, oh, I don't know. Like, she didn't want to answer that question. So as far as family and immediate people around me, I guess like my girlfriends are like the best people that I speak to because we're all going through it together. But I think my theory is you cannot expect people to support you if they don't understand either. So another thing, I was actually thinking this the other day, I was like, we need to get more men that understand what we're going through, and we're not all going crazy, and they understand the why. Hence me bringing Dr. MUBEEM along for the ride. And I'm like, okay, we're going to speak to all men and women. But honestly, I haven't had a lot of people that I can ask family-wise or expect them to support, because my mum doesn't know. She didn't get, I know more than her. And now my friends are relying on me to get the information to share with them. But I do think just having these conversations is the key. And I think it's happening more. And there's, as we said, there's less stigma. So yeah, I don't necessarily have a go-to person other than Dr. MUBEEM, but I'm hoping that just open the conversation.
What does thriving look like during this season of your life?
For me, I think thriving is being able to actually live, I don't even want to say healthy, I'm an active person. I have a lot going on in my life. I'm not trying to slow down. So I want to be able to, I have a 10-year-old boy who's very active. For me, thriving is being able to continue doing all of the things that I enjoy doing. I want to, my family live overseas. I want to be able to continue traveling, for into my 60s, 70s, however long. So just being able to live a full life. That's to me what thriving is.
Okay. And this question is for both of you. What advice would you give to a woman who's entering perimenopause?
Know that there is help.
Okay.
Yeah. Times are different. That things can be done. This is not the end. We need to reframe perimenopause, menopause. It's a phase. It's an inevitable phase. But the suffering, that's an option.
I love that. Yeah.
So you can come in. We can treat that. Look, if you're going through a horrible time, changing what you're experiencing, improving it by even 50%, that makes a big difference.
True.
Right? And 50%, I can guarantee everyone, right? More than that usually, but I would say at least 50%. Right? And that's a game changer for a lot of women. Just being able to sleep 50% better, have lift your brain fog by 50%. You have an increase in 50% of your energy increase by 50%, less pain by 50%. I mean, I'd take that. If there was a pill for that, I'd take it. Yeah.
Okay.
My advice would be to advocate for yourself. I went to see 4 doctors. I'm not going to accept what the first doctor I spoke to that tells me I'm normal and I'm okay. I'm not going to accept that. So I would say, go to a few different medical providers, see who you feel comfortable with, but really advocate for yourself. We know ourselves more than anybody. If you don't feel okay, you don't feel like yourself, speak up.
Yeah, it's real. Your symptoms are real. That's the other thing I think women need to know. It's not my position to tell you how you feel. It's not any other doctor's position to tell you how you feel. It has to be a relationship, and you have to be honest about how you feel. If you feel dismissed, then you need to say that you feel dismissed. I am experiencing these symptoms, and I would like to explore treatment options. In that same vein, you could come in to see the doctor and say, look, I think I'm going through perimenopause. Are you equipped to deal with this? Right? Do you have the qualifications and the training to deal with this? Show me what you got, right? Because I don't want to waste your time, and I don't want my time wasted. There are a lot of great doctors, but that doesn't mean all of them know how to do all the same things. Right? Yeah. Whether it's minor surgery, whether it's treating perimenopause, whether it's dealing with children, everybody's got their niche, I suppose. Right. So if your doctor is the type of doctor who will say, "Look, I'm not comfortable with dealing with perimenopause. I don't have the training to deal with perimenopause," it's probably better if you went and saw Dr. XYZ. Then that's a doctor you need to keep for life, because they're more concerned about you than their own pride, right? They are happy for you to go see somebody because they know you need treatment, right? So that's what we should, as doctors, that's what we should all be doing. We should know what our limits are, but in the same vein, we should all be looking to improve our knowledge as well. So we can, there are 50,000 women on island, right? We need more doctors that can deal with that.
Yeah, true. So, anything else that you'd like for me to ask or answer? Just throw it out there before we wrap up.
Just going back to the HRT thing, one of the questions I get asked a lot is, how long can I take it for? Because there's a myth that you can only take it for a certain amount of time. And that's not true. It's exactly that. It's a myth. You can stay on HRT as long as you want or need to. All right? If it's making you feel better, nobody can take that away from you. Nobody should. Why would you say to a 55-year-old, like, okay, that's it. You've reached your threshold for feeling good. You need to get your hot flashes and your poor sleep and your brain fog back now. We're taking back the HRT, right? No, you can't do that. So you can continue. Sometimes from 55, we, as doctors, we can say, look, let's take a break, see how you feel. See if your symptoms have dampened down somewhat. If they have, but you still have them and they're still bothering you, we can go back on HRT, but maybe on a lower dose. Or you might find that your symptoms are completely gone and you don't want to continue putting on a patch or a spray or a cream any longer. So there is that. But if you don't want to and you feel great, that's your right. Continue feeling great.
I wish we would get to a point where, I was thinking about this the other day, same way the contraceptive pill. They give that to girls of 15, 16 years of age, and girls and women are using it until they're ready to have children 15, 20 years later. There's no stigma.
Right.
How is it any different?
Yeah. And there was a lot of stigma to start with, though. I mean, the stigma around giving young girls
was, yeah.
contraceptives, like sexualizing them, and oh no, this is going to happen back in the 60s.
But I like your idea, Christy.
It's
the concept
like, it's
makes
just,
sense.
It's the same thing in a different stage of our life. It's just like, it's still, you know, some form of HRT treatment. And we just need to get over it and be like, I mean, I personally didn't, because I was so much about, I was like very natural and not going to take those hormones. But, you know, I was young and I thought differently. But my point is, the same way we don't think too much about giving young girls this hormonal, I don't know.
Yeah, hormonal treatment. Hormonal treatment, you're right.
For 15, 20 years. Yeah. Well, we just at a stage of life where this is the next phase of that.
Yeah. And I think a lot of doctors are rightfully scared of dealing with HRT and perimenopause because they don't have that treatment, and sometimes feel the need to do something. Right? Because as a doctor, it's always difficult not to do something for your patient. You want to do something, but we have to accept that sometimes there are not doing something out of your scope of practice is probably the best thing, and getting somebody who does know what they're doing to do it instead.
Well, thank you, Dr. MUBEEM and
You're
Christine,
welcome.
for joining me on For the Health Fit and giving us, our audience, such a insightful view into this natural phase that we all go through.
Absolutely.
I mean, I think men also experience their own changes. It might be a natural progression, right? But we don't have to be stuck. We don't have to grit it out. We don't have to be tired and barely, grumpy.
Yeah.
We don't have to suffer.
Yeah. And that is optional.
We don't have to suffer.
Suffering is optional.
So thanks for imparting that knowledge. Thank you for listening to For the Health of It. Take care and be well.
Thank you very much for having us.
When I first started going to healthcare pharmacy, it was because it was convenient. But over the years, I continued to shop there because I trusted them. One day I was picking up my prescription, and the pharmacist noticed an over-the-counter medication in my basket. She said, "I hope that's not yours. It will interact with your prescription." And I thought, wow, thank you. Trust is so important when it comes to your health. Healthcare Pharmacy with 2 locations, Grand Harbor and Governor Square, where they care about my health.
Running on empty? Feeling depleted? Health and wellness comes down to one essential factor: energy at the cellular level. Our body is designed to support, repair, recover, and heal, but it needs the right environment. At the Light Room, our energy enhancement system is that right environment, a balanced bioenergetic support for your body's natural processes. Don't wait until your energy is depleted. Recharge and keep optimized. Start today. The Light Room, advanced energy therapies that work. We're in Pasadora Place.
If you or your loved one is facing cancer, only Sylvester will stand firmly by your side at every step, from diagnosis through survivorship, providing you and your family peace of mind and assisting with everything you need before, during, and after your stay with us. Sylvester Comprehensive Cancer Center is South Florida's only NCI-designated cancer center and specializes in treating the most complex cancer cases. Your first-class cancer care is just a flight away. Learn more at sylvester.org.
This is For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
When life feels busy, it's time to slow down and tune in. Breeze 105.3 FM gives you the timeless hits, smooth favorites, and the music that feels like home.
Words cannot express how much you mean to me.
Switch now and ride the breeze.
Covering Little Kim and Bright.
Over me.